Hello and welcome to the fourth episode in our series on bipolar disorder. The previous episodes dealt with the introduction, symptoms, diagnosis and causes of bipolar disorder. The next and the most important question what people will ask is, what is the treatment for patients with bipolar disorder? Let us pose questions related to the treatment of PD to our expert. Come, let us meet our expert.
Bipolar disorder is not curable, but it is very effectively treatable with the available medications. So there are many drugs that are now available for the treatment of bipolar disorder, which will ensure that the symptoms of bipolar disorder can be effectively controlled, and the objective of treatment will be to ensure that these symptoms stay under control. That's an important question for which all of us should know the answer. There are different types of treatments that are available, one when the person is in an episode and another when a person is out of an episode and to prevent future episodes. So when a person is in an episode, it could be a manic or a depressive episode, we'll use a combination of medications. So they are usually antipsychotics, benzodiazepines to help improve sleep, and any other medications that may be necessary to control agitation or to reduce suicidal ideation, including electroconvulsive therapy. Once the person has recovered from an episode, most of the medicines that we use in the acute episode may be tapered and stopped. Then we have to continue the patient on a medication that will prevent future episodes. These are called prophylactic medications. Prophylactic medications are something that the patients may have to take for life, especially if they've had more than one episode. And these are medications that have the ability to prevent future episodes. Compliance is the most important aspect of treatment of bipolar disorder. To ensure compliance, the first thing that we need to do is to have a good doctor-patient relationship. That is a cornerstone of ensuring that the patient and the family members will be compliant on treatment. Ensuring adherence to treatment involves educating the patient and their family about bipolar disorder and the importance of medicines and how they need to be taken at the right dose at the right time for the period that the doctor has prescribed. So one of the ways in which we ensure adherence is to have the family members supervise the medication. There is a technique called pill counting by which we can see at the end of the month whether the patient has taken the prescribed medicines or not, and if more than the prescribed medicines are left over. We also have methods of drug monitoring, like for example serum lithium, which will help us know if the patient's drugs are within the prescribed therapeutic range in the body. So there are many ways in which we can ensure compliance. Regular follow-ups, meeting the same doctor during subsequent follow-ups also ensure that the patient will remain compliant for a long time to come.
This concludes the fourth episode in our series on bipolar disorder. This discussed in length about the treatment modalities, mainly focusing on the medications that needs to be administered to the patients with bipolar disorder. We will be back with our next episode. Namaste.